Down syndrome, what families need to know. If you're reading this, chances are someone in your life has Down syndrome. Maybe it's your child, your grandchild, or a little one you're caring for. As an organization that's spent years working with kids with developmental disabilities, I want to walk with you through something that can feel a little overwhelming at first: the common health conditions that often come along with Down syndrome. First, why health monitoring matters in Down syndrome. The first thing you need to know is that children with Down syndrome are just like other kids: curious, funny, stubborn, affectionate, and totally unique. But yes, their extra chromosome, that's chromosome 21 by the way, can increase the risk of certain health conditions. The good news? Most of these can be monitored, managed, and in many cases, prevented from becoming big issues with the right care. First, why health monitoring matters in Down syndrome. The first thing you need to know is that children with Down syndrome are just like other kids: curious, funny, stubborn, affectionate, and totally unique. But yes, their extra chromosome, that's chromosome 21 by the way, can increase the risk of certain health conditions. The good news? Most of these can be monitored, managed, and in many cases, prevented from becoming big issues with the right care. Common health conditions in kids with Down syndrome. Let's walk through the major ones, one by one. 2. Thyroid problems. Hypothyroidism, underactive thyroid, is more common in kids with Down syndrome, and it can affect growth and energy levels. How to spot it? Fatigue, dry skin, constipation, and slow growth can be signs. The fix: a simple blood test and, if needed, daily medication that helps regulate the thyroid hormone. 3. Hearing and vision challenges. About 60 to 80% of kids with Down syndrome will experience some level of hearing loss and/or vision issues. Watch for frequent ear infections, delayed speech, or trouble following moving objects. Action steps: regular hearing tests and eye exams, ideally annually, help catch problems early. 4. Sleep apnea. Many children with Down syndrome have narrower airways and low muscle tone, making them more prone to obstructive sleep apnea. Why it matters. Untreated sleep apnea can lead to behavior issues, poor concentration, and even heart problems. What to do? A sleep study might be recommended if your child snores heavily or seems unusually tired during the day. 5. Gastrointestinal (GI) conditions. These can include reflux, constipation, and conditions like Hirschsprung disease or celiac disease. Signs to notice: vomiting, bloating, constipation, or poor growth may indicate something's off. Get checked. Pediatric GI specialists can help diagnose and manage these effectively. 6. Weaker immune system. Children with Down syndrome may catch colds more often or take longer to recover from infections. What helps? Keeping up with vaccinations, good hygiene habits, and an annual flu shot can make a big difference. 7. Leukemia risk. Kids with Down syndrome have a higher risk for certain types of leukemia, especially in early childhood. The reality: while this sounds scary, early screening and improved treatments mean survival rates are very high when diagnosed early. So what can you do as a parent? Here's a simple list to keep in your mental back pocket. Stick to regular pediatric checkups. Advocate for early screening and evaluations. Don't be afraid to ask questions or get second opinions. Celebrate every milestone, big or small. Lean on your community. As someone who truly believes in the power of early intervention and love, I want to remind you of this. Your child's extra chromosome comes with extra joy, but also extra healthcare needs. And being informed is one of the best gifts you can give them. Conclusion: think of this article as your map to uncharted territory. You're navigating a world that's still learning to celebrate differences. And just like the sailors who sailed into the unknown, you're doing it with grit, love, and a whole lot of courage. Got a story to share? Drop it in the comments. Let's build a tribe of parents who know that every milestone, no matter how small, is worth celebrating.